Hello everybody, welcome to another episode of Bread and Butter Primary Care. I'm Dr. Stokes and here today to continue talking more about cholesterol management and specifically statins. And so today's video is statins, side effects and what to watch out for. So statins are extremely common medications. We use them in a lot of people. There's another video talking all about when to start a statin and how they work. And so then today I want to talk to you just a little bit about the potential side effects, things to watch out for, and what to do when those things happen. So statins are extremely common, and because of that they're very well known, and there's quite a bit of publicity about the potential side effects, and you'll see a lot of talk even in the news about whether or not these drugs are safe and if we use them too much and those types of things. So I did want to address the most common problems that you might run into when you have a patient on a statin and what to do with it. Probably the number one thing you worry about with statin therapy is myopathy, muscle aches. There are cases in which people on statins can have a problem with pain and aching in their muscles. In rare cases, there's even been people who have had something called rhabdomyolysis, where they actually have breakdown of the muscle tissue. This is not very common. Statins overall are very well tolerated, and you don't run into this very often, but it does happen. So generally what happens, you put someone on a statin for their cholesterol, you're usually going to want to see them back in 4 to 6 weeks for a couple reasons. One, to recheck and see if it's made a difference. Partly that's to see if they're being compliant with the medication, see if it's working. And two, to ask if there's any side effects or anything they've noticed. Most often people are going to say no, nothing's going on. Sometimes they'll say, I feel like I'm cramping all over, I've got muscle aches all over the place. And so the whether or not the statin is causing that is a difficult thing to find out for sure. In severe cases, you can actually measure a CK level, a creatinine kinase level, and if that's elevated, then it probably is a statin myopathy, and you should look for other forms of treatment. But there are people who have muscle aches and who do not have a CK level that are elevated. So I certainly have had patients who come back and say, I'm cramping and aching and I just hurt, and I've checked a CK level and there's not elevated, but we stop the statin and the aches and pains go away. And so when you're in that situation, it's kind of like, well, was it the statin? Was it not? I mean, they took it, they had the pain, they stopped it, the pain went away. I mean, so that's kind of all you have to go off of. And so generally speaking, from my perspective in bread and butter primary care, if people are on a statin, they have side effects and muscle aches, then my first step is I stop the statin, give it like another 3 to 4 weeks, see if it goes away. If they're saying, yep, it went away, then I'll usually try a second statin, one that has less muscle aches. So oftentimes the newer statins, say like rosuvastatin, which is Crestor, versus something like atorvastatin, which is Lipitor, you can get similar lowering of the LDL levels with a lower dose and sometimes lower side effect problem. And so if you have someone on 40 of Lipitor and they have muscle aches, you might be able to put them on 20 or even 10 of Crestor, and they won't have the muscle aches, but they'll have similar benefit in their cholesterol. And so you start it. If there's the aches, then you stop it. If they go away, you try another one. If the aches come back, then again. Oftentimes it's a conversation with the patient about risk and benefit, lifestyle things they can do, and whatnot, as far as whether or not they want to continue statin therapy. So the other thing is liver problems. This is also not very common, but it's pretty routine in primary care to get serial liver function studies on patients who are on statins. If they're stable and doing well, we're talking once a year, maybe every 6 months if you see them twice a year, to make sure the liver enzymes aren't increasing or being harmed by the statin. That does not usually happen. I've not ever had that happen for me personally during my practice, but it certainly can happen. So it's something to monitor. So patients who are on cholesterol-lowering medication, statins, check and see if they're complaining about muscle aches. Monitor liver function occasionally, make sure those numbers aren't changing. And if those things are happening, then you can try newer, more potent statins. You can do the lifestyle things and try to find the best way to lower the patient's risk of having heart attacks and strokes and etc. with their statin therapy, but also not having them endure unpleasant side effects. So those are probably the two most common things. Obviously, all medicines have a huge list of potential side effects. It's certainly outside the scope of these videos to talk about that, but the bread and butter things that you're concerned about with statin therapy are probably the muscle aches, the liver enzymes. If you're monitoring both of those and you know what to do if they come, then you should be pretty good. I hope you guys have a great day, and we'll be talking to you later.